welcome. Thank you for accepting our invitation and to be here for this absolutely fantastic event about partnership on promoting sexual and reproductive health in Ethiopia. I represent RnD Associates in the US and RDA Africa. So I'm the founder and CEO of both. So RnD in America focuses on capacity building, so training media, training health professionals, training youth, and training people that work with youth, and training nonprofit programs on building their capacity to impact communities in which they work.
I would like to thank each and every one of you for giving your time and to be here with us in your Saturday morning. So when we say RDA Associates, we are here in Ethiopia and we do have also an office in Kenya. And it's a recently launched group of senior global experts with the mission to provide a human capacity development, connect resources with the needs, strengthen knowledge and skills of service professionals, at the same time develop strong African leaders and help build more vibrant, healthy and safe communities. So as our day, what we do is more of reconnect, strengthen and lead. From our services, we do have mainly these three pillars: the healthcare and the pharmaceutical, the engineering and the manufacturing, and mainly the hospitality and the tourism. So it's a big company that any professionals can work with us from anywhere. So in the healthcare and wellness, we do work on the development of policies and procedures, program management, provision of community health education, and provision of health and soft skill trainings for healthcare professionals. And recently we are also accredited by Ethiopia Medical Association, and we can clearly provide, different trainings. It can be national or internationally accredited trainings, and we can professionally certify those trainings. And we do also do the analysis and promotion of gender equity in health education management and PMP certification. At the same time, we do also provide ISO certification trainings.
Whether it's a woman in rural Ethiopia or a woman in Addis Ababa that we spoke to, we found three common problems that women had. And this is what YeneHealth is trying to solve. We're starting in Ethiopia, it's our home. We think that it's needed here, but we definitely plan to grow and scale across Africa. It's actually expected by 2050 by UNICEF that women of reproductive age across Africa will reach 500 million. That's a massive population that needs to be served. So we believe that using digital can really help us reach the most number of women at the least possible cost as well. We at YeneHealth are trying to unlock the digital door for health services for Ethiopian women, but also women across Africa. So how it works is quite simple. A user from the safe and privacy of their home, they download our app or go on our website. They can learn, monitor and track their pregnancy, their fertility, their menstruation. They can shop and order for products. We also have, again, the discreet delivery available. And lastly, we link them to support lines. We're also thinking about expanding and offering different linkages through labs and different things that women may need, again, to give them a better experience around accessing services. So our theory of action is quite straightforward as well. We believe that if women have direct access to the information and a broad range of product choices, then their uptake of these products will also, and their overall health will be improved, including their self-agency. So we really strongly align with SDGs 3, 5, and 17 to work towards bigger global agendas as well.
With technical and financial support, we have transformed the one branch of St. Paul Hospital. If you know the Center for Reproductive Medicine, it's a branch of St. Paul Hospital around Hyolet. So we entirely supported that institution to transform from paper-based to electronic-based. So everything has now changed to electronic-based approach. And then we take that experience and now we are trying to transform St. Paul Hospital fully into an electronic-based registration and documentation. But this is not enough. We are a country of more than 110 million people, so the demand is there. We really need, to join hands and work together to transform, the country's documentation, the country's health.
One of the things that we're going to do is really find out who is in the room, and then also find out from your perspective about myths that you heard growing up regarding sexual and reproductive health. So you're going to talk about that in your small team.
While in Rwanda, we would see circumcision for male, like a non-circumcised man cannot sit with other group. Like he eats with other group, the food will not taste the same. So you must get circumcised by the age of 12. So when we come to the case of Ethiopia, uncircumcised women are like assumed to have some bad behaviors. Like if someone is not behaving well in the community, they will take it because she's not circumcised. People would start saying, she's not circumcised.
The other taboo is cultural challenge. People are not very much comfortable talking about these things out there, right? Not with your family, not with your even colleagues. Professional people are not happy to talk about reproductive health. So our colleagues were saying, even professional, like people who have education, with so much problem, they'll not be open to talk about it. So that's one of the cultural challenges we have.
Yeah, so when we're talking about some of the myths that exist currently, you know, we have a cultural taboo in the whole ideology of discussing sex. Me and my mom personally, we had a case study and we've never had that discussion. You know, my mom's a health professional, my dad's a health professional, and we still haven't had those discussions. You know, even though we're open about other topics, my parents are educated, I'm educated, and you know, we still haven't had those discussions. And it shows like how deeply rooted it is in the culture to not discuss, even amongst the most educated. Religion was also another one. So religiously, you know, there's a religious taboo within families. I was the one that was least comfortable discussing with my friends. You know, as men, sometimes it's kind of difficult to have those discussions about, you know, sexual health. But yeah, we were all pretty comfortable discussing with our health professionals.
So even in high school, Manna mentioned if girls have a bigger breast, there was a common misconception and a myth that they are having sex at that time, and that was uncomfortable for girls at the high school. The next myth was, you want to help me, Manna? Get up here.
One is, as a professional, we have to be open to talk about this.
Now, most young generation spend much of their time, more than 80-90% of their time on TikTok, Facebook, and Instagram. So the classic teaching of classroom methods or classic paper-based method cannot work anymore. So I think we need to come out on TikTok. We need to talk on Facebook, on other digital technologies, so that we can have the young generation, help the young generation access the ASR-HR. So I think what YeneHealth is doing is amazing. I've been able to attend the first launching meeting a few months back. They have done a lot of job in probably few months' time. So I hope we'll continue to work together. Congratulations again. Thank you so much.
It's clear that the world is moving toward a more technological arena, and we think having more digital technology where people can access information themselves, not being influenced by others, and trusted media, and working on youth-friendly media. These are our points, and we believe others will add more. Thank you.
We said creating a space where people can ask questions anonymously, and also spreading awareness through creating content. What else did we say? Creating more content available for everyone to use and in different languages, accessible to everyone.
The challenges that we have is maternal mortality rate, where we are unlikely to meet the SDG target of 70 per 100,000 population, because we are at 412 per 100,000 population in terms of maternal mortality rate.
One of the things that really excited me is YeneHealth will allow us on our issue of women empowerment, and as Manna and the Qadist has very well mentioned, they have said that it addresses the women will have most of the information at their fingertip, and they also have a plan of providing adolescent education. This is also one major challenge: sex education, family planning. One of the challenges we face as sexual and reproductive health providers is the socio-cultural barriers, and there is still a challenge even in the age of information. We don't have information. Most of the adolescents, they get their information from their peers, and that most of that information is not right. It's misinformation, and there are again the taboo is there, and the added COVID pandemic, the humanitarian disaster. These things, they have increased they have compromised the quality healthcare and even the availability of healthcare. So the digital healthcare will address the misinformation and the lack of data.
To sit in one room, to hear YeneHealth, to hear all of you and the pharmacy and your son who was sitting there and saying to me, I went to the same school that her son went, Sanford School back in those days. There was no sexual education. No, are you kidding? No. The teachers were haunting us if they see us with boys, let alone sexual education. So yes, there is a huge change, a beautiful change. With all due respect for my fellow man, a woman has always been the neck, and a man has always believed to be the head, right? And we've always turned the guys around, but we never had the confidence. We're always suppressed. We've always did not believe in ourselves, even though we were doing the work, right? So for us to be open and talk about these things, that's huge. Sexual identity or sexual reproductive health is human dignity. It's human rights. It's public health.